Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and take actions to make a better system for all of us. Before we get started, let me point out that down below in the YouTube description box is a link to the Healthcare Advocacy newsletter. It contains lots of health-related references for you, advocacy-related references, and it is the text for this video. And it has all of the links to the scientific studies and news articles and references. Anything I mention is linked in there. Anyway, it's free. You can subscribe there and get it delivered to your inbox almost every day. So I want to talk about prior authorizations. In fact, this part is called Prior Authorization Hell. Recently, we had a discussion about prior authorizations in the newsletter. This is a technique where commercial insurance companies slow down their payments and they outright deny paying doctor-ordered treatments as if they know better. We covered the case. It was a tragic case of a young man in Illinois. He was insured, I believe, by Regents Blue Cross. He had stomach cancer. His doctor said, you need chemotherapy and surgery. His authorization was denied. They kept appealing it. And the result was he didn't get it, and he's dead. And 40 years old, and he leaves a widow and I think 2 children. It's just tragic, but they got away with it. Anyway, we also compared Medicare Advantage Part C authorizations to traditional Medicare. Now, there are about 50 million per year Medicare Advantage authorizations and about 400,000 for traditional Medicare, which is the public insurance trust. Of those 50 million that are requested prior authorizations, there is a denial rate. They deny almost 4 million of them every year. Compare that. Think about it. 50 million versus 400,000. And both those populations are about the same size. It's about 34 million Medicare Advantage and traditional Medicare. So you pretty much don't have prior authorizations in traditional Medicare. Well, the American Medical Association has now decided that they hate prior authorizations. Part of the reason is that their judgment is being called into question on what is effective medical treatment. And doctors don't like to be called out that way. That's just, they're the authority, and you have somebody somewhere else who is a nurse or better trying to just say no. Anyway, here's the AMA's position on prior authorizations. Cut the overall volume of prior authorizations because it eats up a tremendous amount of their time. Increase transparency of requirements. Let us know what we have to do. Promote automation. I'm not so sure that's a good thing because they can use automation for denials as well. Ensure timely care for patients. That's important. And in particular, the American Medical Association would like volume reductions. They don't want to do as many. They want to make sure that if the patient is going to be harmed by not getting the authorization, that the insurance company is not allowed to do that. They would like to prohibit, I love this one, prohibit retroactive denial if the care is pre-authorized. Make sure the authorization stays valid for at least a year. For patients with chronic conditions, the prior authorization should be valid for the whole length of the treatment. Require public release of the insurer's prior authorization data by drug, service, and device as it relates to approvals, denials, appeals, wait times, and more. That's so all of us can see how the insurance companies are doing. Prohibit plans from requiring prior authorizations when patients switch plans before they can get coverage for ongoing care. All of it sounds like a Band-Aid to a really broken system, and that's exactly what it is. It's just a Band-Aid, and if they fix that, we still have a broken system with health insurance companies taking away like 20% of the money out of the system into unneeded overhead, a minimum $400 billion a year. Do we need to pay for that? I think not. What we really need is universal health care, funded by a public insurance trust like Medicare, that's not doing the prior authorizations, like Medicare, compare the difference. 50,000 prior authorizations for Part C, commercial, versus 400,000 for traditional public insurance trust Medicare. For me, universal health care, yes please. Courts to Trump. Hold it right there. Regarding Medicaid, a New York Times article, and there's a link to it in the newsletter. Judge rules that Trump administration defied the order to unfreeze billions in federal grants. A federal judge said on Monday that the White House had denied his order to release billions of dollars in federal grants, marking the first time a judge has expressly declared that the Trump administration is disobeying a judicial mandate. The ruling by Judge John J. McConnell Jr. in Rhode Island federal court ordered the administration officials to comply with what the judge called the plain text of the ruling he issued on January 29th. Let's see what Trump does now. How about medical research? NBC News reports a judge blocks the Trump administration from cutting that research funding after 22 states sued that was illegal. A federal judge temporarily halted the Trump administration's radical changes to how the National Institute of Health pays for biomedical research, putting on hold a plan to slash research funding paid out by the federal government. 22 states' attorneys general filed a lawsuit on, I'm sorry, my phone went off. 22 state, it's a new phone, I don't know how to turn it off. 22 state attorneys generals filed a lawsuit yesterday against the plan, which would limit how it pays universities and medical institutions for indirect costs, like staff and buildings and maintenance and labs. And in addition, after those 22 were suing, Carnegie Mellon University said, we too, and they joined the lawsuit. Look, we don't know what Trump is going to do now, but we can take action. We can raise our voice. Now, in my new neighborhood in Vancouver, Washington, we have organized marches and rallies. We have had 100 people show up at our senator's office on just a few hours' notice to encourage them to be brave in the face of the onslaught from these fascists. If that kind of action sounds good to you, there's a link in the newsletter, and I'll put it into the YouTube description box, to Indivisible. Tell them you're interested. They'll put you in touch with a local organization. There will be plenty of anti-MAGA rallies at noon on President's Day. I'll put a link in the YouTube description box. It's also in the newsletter from 5051 to find one near you. If you're in Southwest Washington, we'll be at Esther Short Park in Vancouver at noon on that day, on President's Day. Okay, what else can you do? You can tell your member of Congress and your senators not to negotiate with the Trump fascists. Our representatives need to do everything in their power to slow down this MAGA onslaught that will destroy democracy. You need to let them know you will support them vocally for their courage, and you will be just as vocal if they cave in. They need to know there are consequences. Their contact information is in the YouTube description box. If you're uncomfortable calling them, calling works really well. If you're uncomfortable, call in the evening, leave a voicemail. You can use the ResistBot script below as a template. Or if you want to use ResistBot on your cell phone, send a text message to 50409, or you can use Messenger, Telegram, or Instagram. The message is sign, S-I-G-N, space, PQOABO. Sign, space, PQOABO to 50409. I'll read you what you'll send. I'm your constituent, and I am deeply concerned by the Trump administration deciding they don't have to spend the money Congress reallocated. This includes halting Medicaid payments, refusing to open new authorized medical research grants, seeking to cut food assistance when 42 million people need that monthly. They cut foreign food aid, and that hurts U.S. farmers as well as those that are hungry overseas. Their attacks on women, that's the SAVE Act, and the LGBTQ community are reprehensible. I want you to stand up to them and stop all business in Congress. until they stop breaking the law and destroying our democracy. I will be vocal in my community to support your courage, and I will be equally vocal if you fail to do so. That's what I've got for you today. You can like, share, subscribe. Please take those actions. It is so important that we stand up at this time. You can send me comments here or at healthcareadvocacy1@gmail.com. Have a good evening.